Well, right now, a massive spending bill is now in the hands of the U.S. Senate. President Trump says he wants what he calls the big, beautiful bill on his desk by July 4th. But senators are looking to make some changes to the bill. President Trump spent today speaking with some of those concerned senators. Some have expressed concerns about cuts to Medicaid and the potential impact for low-income Americans. Others say they'd only vote for the bill if it doesn't raise the debt ceiling.
Can't accumulate more debt. $2 trillion in debt this year is too much.
I think we can get there, but it's not going to be a guaranteed passage of the bill the House sent us.
Well, if every Democratic senator votes no, Senate Republicans can only afford 3 no votes within their own party.
Well, one healthcare organization here in Central Ohio is at risk of losing federal money if that bill is passed.
It's called COTS, or Central Ohio Trauma System. The organization brings together healthcare agencies from across the region to collaborate.
10 TV's Tara Jabor joining us now live from downtown Columbus. And Tara, you spoke to COTS at their meeting today. What did they say about those potential cuts?
Well, Angela, COTS receives over $1 million from the federal government every year. Now they're at risk of losing that money and trying to figure out a way to prepare for that if it does happen. Today, COTS brought together hospitals, law enforcement, EMS, and fire to discuss red, white, and boom.
To talk about what a response would look like if something happened at Red, White, and Boom. So how would we manage the patients in a mass casualty event if something happened during Boom?
Every year, COTS helps bring these emergency leaders together to plan in case of an emergency.
Hospitals didn't want to be on their own during a disaster. They wanted to work together to spread the load of patient care and work together and have somebody coordinate that.
Now, COTS organizers say they're at risk of losing federal funding if President Donald Trump's One Big Beautiful Bill passes. The bill aims to cut $1.5 trillion in spending.
There is some risk that we will be losing our federal funding. We're being very proactive, though, and working on a sustainment plan for that.
This year, COTS got $1.4 million, and without that money, they'll have to pivot to find a new way to continue to do their work.
We don't want anybody to be the weak link, so we want everybody to have plans in place. We want everybody to be able to work together.
Leanne Worcester with Nationwide Children's Hospitals says that she's confident that no matter what, the hospitals will work together to protect the community.
We want everyone to be able to go down to Red, White, and Boom and enjoy themselves and not have to think about all the layers of preparation that go in behind the scenes.
And COTS has been around for 27 years. They hope to continue their work in the future. Reporting live in downtown Columbus, Tara Jabor, 10 TV News.
All right, thank you, Tara.